An update tonight on monkeypox in Southwest Virginia. Today, Dr. Cynthia Morrow, the director of the Roanoke City and Alleghany Health Districts, spoke about the risks and what to look out for. WFXR's Amanda Lee joins us live from the newsroom with the latest on that. Amanda, what can you tell us tonight?
Kathleen, a lot of people have been wondering if monkeypox is going to spread similar to COVID-19. Now, the difference is COVID could be spread through airborne particles and droplets. Now, with monkeypox, you've got to be very close, making skin-to-skin contact for a while. That's according to health officials who I talked to today.
There is a very, very low risk of respiratory transmission, but overwhelmingly the transmission is direct contact with the skin of someone who has monkeypox sores.
On Tuesday, VDH reported 112 cases in Virginia, 111 of them male and 1 female, all ages 20 to 60. In the Southwest region, they report a total of 3 cases and say more than 30 doses of the monkeypox vaccine have been administered.
We know that people are at greater risk if they have multiple sexual partners, and if they have anonymous sexual partners, and if they're a commercial sex worker.
Dr. Charles Schlupner with infectious diseases at Carilion Clinic explains it's not a sexually transmitted disease, but rather a disease that's easily transmitted during sex.
Just brushing up against somebody's shirt sleeve, pretty low risk kind of stuff. If they happen to have a lesion, does it possibly throw you into an intermediate risk? Yeah, sure. But that means you just watch for it.
He says before skin lesions or bumps would start to appear, people who might have it would experience other symptoms.
Fever, headache, malaise, not feeling well, and you might even detect some lymph nodes, some swollen lymph glands in your neck or your armpit.
When it comes to vaccines, doctors say there is a limited supply, but aren't concerned about not having enough.
People who are not in those high-risk groups don't need it. This is not a disease that is casually transmitted.
Right now, the vaccine is not being distributed in local pharmacies, but rather health clinics like Carilion. Dr. Morrow says at this time they don't expect it to be anything like COVID-19 because of the transmission. Reporting live in the newsroom, Amanda Lee, WFXR News.
Amanda, thank you. Now, having symptoms along with having been in contact with someone who may have skin lesions or recently visited a place with higher cases would be cause for calling a healthcare provider.